Hello, I'm Dr. Annalene Weston, dental legal consultant at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at the key dental legal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. So in this edition, I'm joined by my colleague and fellow dental legal consultant, Dr. Simon Parsons. Hello, Simon.
Hi, Annie.
The busy and often unpredictable nature of clinical practice really challenges us as dental practitioners. How do we stay on top of all of our work? How do we avoid constant battles with the incredibly scarce resource of time? How can we stay on time in clinical practice, and should we really worry about it too much? Or is it only going to add to our cognitive load and stress? Is it really all that important? And what are the repercussions anyway if we don't run on time? While many of us know the answers to these questions from our own experience, research is shedding more light on why punctuality in the workplace and our time management skills are essential to our well-being and assist us in achieving high-quality patient care. So let's venture down that rabbit hole and see what we come up with. So Simon, this podcast probably touches a bit of a nerve for many, and I know from my own experience in the surgery that running late can really ruin my day. And I mean really ruin my day. But really, is it such a big issue, or am I just being too tough on myself?
Well, I'll answer your second question first. No, I don't think you're being too tough on yourself. Dentistry is hard enough without being loaded with further pressure from needing to stay on time. Running 5 minutes late for your next appointment is probably not a big deal, really, for you, any more than it normally would be for me. And our patients and support staff are usually pretty understanding. After all, when do you get to see your doctor or your hairdresser on time these days? But I think it's fair to say that running late adds to our overall levels of anxiety, especially if we're already tightly booked and we're worried we could need more time rather than less for one of our patients later that day. Will it escalate into being maybe 30 or even 40 minutes behind if that extraction happens to become a surgical? Last time the rubber dam clamp kept slipping for that endo patient, and will it do it again and then derail today's appointments too? While we are responsible for our actions and in theory could simply shrug off a lack of timeliness as not worthy of getting stressed about, it's fair to say that our DAs, receptionists, and most of all our patients might not feel the same way, Annie, and see it as highly important. So yes, it can be a really big issue, as I'll explain in a few minutes.
So what are you really talking about when you say time management, Simon? Is it just staying on time, or is it a more sophisticated issue?
Well, the management and health literature seem to define the concept this way. They say it's a form of decision-making used by individuals to structure, protect, and adapt their time to changing conditions. Now, structuring is something we already know quite well. It can involve well-practiced routines, a lot like how we conduct a checkup appointment. It also uses concepts like an appointment book to organise one's workday. Protecting, though, is not as familiar a concept and may look quite different from one person to the next. If we are really disciplined, we may set up emergency slots in our books to not only provide access to our patients requiring urgent care, but also minimise the destabilising impact that walk-ins can have to our structure. But do we protect our lunch breaks? Can we say no to those patients trying to place additional demands on our time, such as our patients who are keen to get treatment completed, such as a restoration at the same time as their checkup today? Adapting is that third aspect, and it's really being able to evaluate and, if necessary, adjust what we do to evolving conditions. Where I work in the Sydney CBD, train strikes and wet weather delays can really impact on my patients' arrival time sometimes, as so many people rely on public transport to access the practice. So as a practice, we have to adapt to our patients arriving late every so often, juggling people around to try to fit in as many of them as possible. I don't really want to have to cancel an elderly patient's appointment that they've waited weeks or even months for and have now spent more than an hour trying to get to if I can help it, just because they've run a few minutes late. So besides, no patients means no income, right? So adapting is a critical part of time management and something we often do instinctively, but sometimes also we'll have to do really carefully, selectively, and even strategically. I guess this means that time management takes conscious effort and is much more of a mindset than a chance happening.
So let's say for a moment that we agree that time management, despite the effort it might take, is a good idea. Does time management really work, and where's the evidence?
That's a very good question. And like everything else we do in dentistry, Annie, I agree that we should have a sound basis for doing it rather than just acting like sheep because lots of others do it. So I'm going to give you an answer you may not like. I would like to say that the answer is yes and no.
Really?
Yes. You see, we can try to organise and structure our time really carefully, the way it was drummed into me when I learned how to do four-handed dentistry. We can prepare our instrument trays for the day, have every rubber dam clamp in stock and have it set up, have checked all the lab workers having arrived and that everything fits the models that they've come in on, and we could have confirmed all the appointments. We can allocate catch-up time and protect our breaks by scheduling them as unbookable. Yet things still can and do go off the rails from time to time. It only takes one event to derail the rest of the day. So I guess my view is that time management is not just a good idea, but actually critical to our professional success. Dentistry is inherently detail-orientated and we're nearly all perfectionists at heart. It's incredibly complex when a root canal procedure or implant needs to be done, requiring multitudes of components and plenty of stereo tracking. But I liken it to planning an overseas trip. And, in cases like that, I outline an itinerary and where I expect to be at a particular time on a particular day. We all need to be flexible when we're travelling. There's a lot of evidence in the literature that time management enhances our job performance, our overall achievement, and our well-being. It can help keep us productive. But the evidence varies from study to study, and some of it suggests that if we increase our effectiveness, we may adversely impact our well-being, perhaps due to working consistently hard. I know from first-hand experience that I can have a smooth and productive workday, derive a sense of achievement from that, but by the time I get home, I can feel really physically exhausted. So much so, I have had conversations with my colleagues on many occasions where they joke with me that it's unusual to see me not busy, and I tell them I'm delighted to have an FTA, so I get to not only have a bit of a chat to them, but also enjoy a decent coffee between patients. You get the picture.
Yeah, I don't mind an FTA, I have to say.
Especially if you've got 5 or 6 hours in it as
solid.
Solid.
I think that comes with age. It used to really stress me out when I was younger because I'd worry. Because as you said, no patient, no income, no what's happened, But now I don't mind one at all.
Yeah, it just gives you the chance to breathe.
It does.
So perhaps a good starting point on that point then is a really interesting article I came across by a fellow Brad Eon and his team in the journal PLOS ONE from January 2021. They conducted a thorough literature review on the whole subject and narrowed the data down to include 158 studies in order to see if they could get some straight answers on this whole question.
That's fantastic. Now, we're going to pop this reference to this in the episode notes for our colleagues to read. But just to précis for us, Simon, what were the results?
Well, although they commented on many issues, I noted 4 main areas in their study that stood out to me. So I'll share those with you now. The first was performance. And this is where they found there was a moderate impact on performance at work from good time management. However, they noted 2 aspects to the notion of performance. Performance outcomes as such, which they called results-based performance, and a second, which they called behaviour-based performance. they found that the impact on behaviour-based performance to be much greater than on the result-based performance, but that ultimately it was not statistically significant. Actually, both benefited from careful time management, and that makes intuitive sense. We behave better and we get better overall results in our work performance. What I found really interesting, though, was that they found that the relationship between time management and its impact on job performance has significantly increased from the early 1990s through to now. In other words, as we seem to have gotten busier in our work lives, the need for time management to keep us performing at our best has been even more profound, and I'd argue more critical than ever before.
Yeah, agreed.
Yeah. We're almost a victim of our own success.
I think so.
And the second finding was that well-being was also measured, and here it had a little more impact than on our performance. Time management, when done effectively, they found to have a positive impact on our well-being. Interestingly, though, in measuring that impact, they found it had a 72% stronger impact on life satisfaction than job satisfaction.
Okay, so the second you said well-being, obviously my ears pricked up. So do you think they're saying here that the flow-on effect of good time management in the workplace is a happier life overall, not just a happier or more rewarding workday?
Yes, I think that seems to be the case. What we do at work and how we do it can have an enormous impact on how we view life generally. We can be happier from doing our work in a smoother and more predictable way, but more importantly, this seems to disproportionately benefit how we view our lives in a broader sense.
That's interesting. What were the other findings?
Well, the third was the correlation with distress. Time management seemed to help allay distress, and they noted it had a bigger impact on psychological distress than physical distress. Part of this analysis was that they said that our self-efficacy is a distinct predictor of our well-being, helping us to basically feel in control and be effective when our self-efficacy is high, while any neuroticism and various difficult life events can be predictors instead of distress. So again, if we're prone to distress or feelings of being swamped or out of control, it makes sense not to load ourselves with even more reasons to feel distress from managing our work time ineffectively.
So in other words, Simon, our own makeup and how we see ourselves might have a stronger impact on our sense of distress or well-being than time management alone?
Well, that's what I understood from the review, yes. And it didn't greatly matter how smart you are. There wasn't a strong link to one's cognitive ability in that sense. So I gleaned from this, hopefully correctly, that our personality and our own view of ourselves is definitely a predictor of how we will feel about our workday each day. So we need to recognise that. We need to be in tune with ourselves and act in such a way to enhance our well-being and minimise causes of distress.
Anything else?
Well, the study kept on going, you see. The fourth area was determining any link to individual difference, such as age or gender, the number of children we might have, and so on. It won't surprise you, Annie, to know that there is weak evidence to show that women are better at time management than us men.
Yeah, I doubt it's that weak, Simon, but carry on.
Yeah, well, I won't really go down that rabbit hole if I could help it. But let me move on quickly then to note that there was a pretty strong link to one's self-esteem, which can also correlate with one's self-efficacy, and our own locus of control. And I guess by that we mean our ability to perceive we're in control of our lives. Those of us who feel we've got a strong handle on life probably already implement good time management and see the bigger picture, perhaps not over-egging a day where we've run late to suggest that we're a bad clinician. There's a strong link to our conscientiousness too. And here the assumption seems to be that conscientious people are usually well organised to start with, so perhaps one builds on the other rather than being separate considerations.
Yeah, makes sense. So how do you think this all applies to our dentistry and our work lives generally?
Well, as usual, that's a further really good question, because I tried to find evidence of studies on time management in dentistry, and of course, it's scant. It means I don't really feel confident sharing very much from the literature to back up my views. But I hope you will allow me to look at the question from my own experience, as flawed as that might be. Well, let's start with our undergraduate training first. Mine began with 3-hour sessions for the treatment of just one patient. And over time, this devolved into 2 patients being seen in that 3-hour session as I increased my speed and experience in doing restorative dentistry and pros. But I'd wait ages for my demonstrator, as we call them, to come and check off each stage of my work. I didn't have a DA providing suction or any other support, except on very rare occasions when, say, impression material needed to be mixed. And really, none of this was conducive to learning how to manage my time well in a clinical setting. And I have to admit, I found working in much shorter appointments upon my graduation very challenging and initially quite unsettling, if I wanted to be honest. There is one study by Yi-Young Fang and her team in the Journal of Dental Hygiene, again from 2021, that I came across, that supports a similar conclusion for dental hygiene students. And in that study, they commented that the clinical training models being used might not adequately prepare students for the realities of clinical practice upon their graduation. And I think in one sense, that's an affirmation that resonates with me. Most of us repeat tasks along the lines of how we've been taught, because that's the way we know how to do things. And if we've had almost unlimited but equally quite disrupted time, we will find it hard to manage our time differently when the opportunity presents itself. And we're going to have to experiment to work out how to do it. So I've deduced from that our time management is really a skill that we need to learn and then consistently perform well. We can have good clinical skills, but really poor time management ones, and discover that we get ourselves and our patients and our colleagues all offside. You're not going to develop that skill really quickly in a private practice where they encourage lots of walk-ins, or where you're told to build your own book and have huge gaps between your appointments, unless you become adept at fitting patients into the available slots or between book patients. And I remember early in my career, I found it challenging seeing relentless levels of emergency patients who were all walk-ins in the A&E department of the public hospital that I was working in. And I simply wasn't fast enough to make a quick and confident diagnosis and determine the treatment plan, and then either sort the issue out or refer the patient up to the oral surgery department for an extraction.
Yeah, that would be quite a full-on role. And we're all a bit slow on graduation, don't you think?
Oh, I think so, yes, for sure. I guess it depends on how quickly we learn and how quickly we organise and structure our time, learn what our limitations are, and whether we're able to consciously protect some of that time, and then sort of adapt to the ebb and flow of our workday. And they're skills that can be learnt through experience.
Is there anything else, though, do you think?
Yeah, I do. I think let's actually talk about the whole original question of punctuality when you opened the podcast. And I'm talking about whether we arrive to work before our day begins instead of on the dot or afterwards. And I have to confess that I've taken the occasional member to task when they've reported that they've been getting into trouble with their practice principal or practice manager over running late and turning up to work late. The two have gone hand in hand. And I've actually had to remind them that time management relies on what the author Stephen Covey would argue as a concept of beginning with the end in mind. So you need to set yourself consciously up to make your day work. You can't expect to show up to work late and still have a smooth day. In my view, you have to get to work before your first appointment, review your day sheet, talk through any roadblocks with your DA, and then start structuring your day and working out what exactly you're going to be doing. And in my own practice, I check to see which patients are likely to need radiographs or other investigations that take a little bit of extra time. I check to see if anyone's allergic to penicillin or latex and all that sort of thing. It helps keep me on time later and also guides my DA in how she will need to manage her time to work in with mine. We discuss the troublemaker patients who we know always arrive late, and also the inquisitive ones who seem to have 20 questions at the end of each appointment. You've been there, Annie. And we flag them so that we can be on the front foot and we can adjust and adapt wherever possible. But I have no time for those fellow clinicians, our colleagues, who expect their patients to always be on time, yet they themselves arrive to work late and then have to walk past their first patient who is already waiting in the waiting room. And not only does this smack, in my view, of unprofessional behaviour, but it also means you're really unlikely to remain on time, or at the very least be prone to being really disorganised and likely to encounter an increased risk of clinical error.
I can tell this is a big issue for you, Simon. So why is it so much of one?
I guess I'm a perfectionist, but I think you are too. For me, it reflects a mindset. You know, you're either committed to trying to get things right from the outset or you're not.
So what else do you need to commit your energy to, though?
Something else that I feel is really critical, Annie, is to ensure that we don't adopt a cookie-cutter approach to appointment times. In my view, our new patients need more time allocated to them than routine recalls, as there's more history taking and charting to do. We'll almost invariably take some radiographs. We need to build some rapport, and we've got to discuss any treatment plans going forwards. And at the same time, a lot of children don't always need a shorter appointment, but a lot depends on their compliance and behaviour. So, you know, we see it also with our endos and, you know, some restorations that can be really straightforward, but on a different patient, the same tooth on a different patient will be taking you a lot of, maybe a lot more of a challenge. So we need to allow what we think is enough time for each patient and customise it wherever we can to the individual circumstances that we're aware of and also our own strengths and weaknesses. You know, if I was to allow my receptionist just to book half an hour for every slot and I have to try to manage patients to that time frame, I think would be absolute nonsense because it's actually not realistic and it doesn't allow me to be efficient.
That impacts me too, but I think one of the problems that creates that is on the online booking, the patient themselves doesn't know. They just book a standard check and clean, say. They don't know if they need longer and they wouldn't think to say that they needed something different. So I think, I agree, it's a nonsense, but I think it's perpetuated with online bookings. And one thing I like to do is have a look at my book and see what it looks like so I can go and amend or adjust accordingly if needed.
I agree. And, you know, it's really helpful actually when I'm in the practice to look a week ahead. And so if patients need to be juggled based on what I know of them, I can get reception to start moving a few people because often they don't reach them the first time they try. And we've got to try for a couple of days before we actually get to make those changes. So it's a really good point, Annie. I also think we need to be realistic and balance our sort of productivity expectations with our overall expectations. I know a very capable colleague who is a lovely person, and I've known her for 20 or 30 years. And unfortunately, she has a terrible reputation for keeping on time. She's a really nice person who's just lacking in punctuality. And she seems to run over 30 minutes late each workday, and often it's by sort of mid-morning. And I've heard stories of how this really disenfranchises her patients who have turned up early or on time, particularly if they're paying for parking or they've got another appointment straight afterwards with an optometrist or doctor. And in exploring why she does this to herself and others, it seems that she is particularly good at wanting to do what she thinks is going to be something quite simple like a class 5 composite at a patient's checkup appointment, often when she is already running a bit late. So she doesn't really know how to say no to herself.
She might feel guilty too if they've been kept waiting already, and she might feel guilty about them coming back. So she tries to fit stuff in.
And, you know, it's sort of being a bit of a superhero. I think, you know, you can almost try too hard and be your own worst enemy. And she's also guilty of doing what I consider to be fairly crazy things, such as, polishing and polishing and polishing that restoration and taking forever to choose a shade. And often, to be honest, I think those of us who've been around for donkey's years know that most of the time our judgment is pretty reliable and those things should only take a minute or two. And the patients don't really derive a lot of value from obsessing on that. She writes really copious records for even the simplest procedure, and she sort of dithers. She can't make a decision about what material to use. So I think people can be very conscientious, but it can be to their own detriment. And in my colleague's case, their patients end up, her patients get really frustrated with her, and she loses quite a lot of them. She either keeps them waiting or she's going to have to cut their appointments short. And it can really impact long-term on the continuity of care if they then transfer to another clinician or even another practice. And I think her expectations of also perhaps maximising her revenue for the day by doing that extra procedure, because that's an extra $200 that she's going to bill, is going to be diluted in the long run by having to either cut something else out later in the day, or the practice is going to pay overtime to the support staff because she's going to finish sometimes hours after her scheduled finish time. And that then creates this whole issue of security at the practice and the hysteria and, all sorts of flow-on effects that actually mean that you're probably no better off. So I feel we need to be realistic about our own clinical abilities and our expectations and whether we can really complete a task in the time that we have available. And if it's going to cause us to run a bit over time, whether it's feasible that we can catch up later or not. And that's going to be driven by our self-efficacy. Annie, I'm sure you know pretty intuitively those patients where you're going to be able to do something quickly and catch up. You know them well enough and you know your ability. You can speed up if you need to on that particular procedure. I think it's also a product of leadership and autonomy. And as clinicians, we're the clinical leader. So can we say no to our patients when they might place unrealistic demands on us? I think we have to. Not all the time. Sometimes it's reasonable what the patient is asking, but from time to time. And by all means, we should try to do our best to accommodate the needs of our patients, but we also need to try not to cause detriment to the people who are going to follow.
Yeah, that's a bit of a pet peeve of mine, actually. I hate waiting beyond my appointment time when I'm getting something done. So I try to respect my patients by not doing the same to them. But sometimes it's hard.
Yeah. And I think that's one of the reasons why we really need to be really organised. I've commented already on this, but it really does help to write up your day sheet, to have templates to help you structure your records, to have a routine that you follow pretty strictly. And while all of these might sound a little bit inflexible, they're not meant to be. They're meant to just optimize your efficiency. And I did come across a study based on a review of healthcare workers in a busy hospital in Ethiopia. And in that study, they noted that health professionals who effectively planned their tasks were roughly 6 times more likely to have good time management skills than those who didn't. So if we do decide to extrapolate that to our own clinical situation, I think it would suggest that good planning is conducive to better overall time management. But I don't want you to think that means that we've got to adopt a straitjacket. You can still adapt your records, you can adapt your schedule or the order you do things in an exam to suit the circumstances. And I've lost track of the number of times a patient's booked in for a checkup, but they've broken a tooth, so I do a filling and I don't do the checkup. And that's okay, but I don't try to do both. Unless it's something really minor. In my practice, my most frequently rostered DA with me, because it's on a bit of a flexible roster, who's amazingly adaptable and just happens to also be called Annie. She listens really carefully to my banter as I begin a checkup appointment, and she's sort of reading the room. She knows that if a patient says they've broken a tooth, that I'm almost certain to attend to that first. And so she starts packing up the checkup equipment and setting up a restorative tray before I even say anything. And she'll work around me, and while I'm taking more history and running any tests and so on, she'll get everything set up. So that way I stay on time 90% of the time. If I don't get to do the checkup, I explain to the patient why, and I don't try to push too hard on it, and most of the time they don't push back. We're a team, my DA, my patient, and me. And I want to respect everyone's time. I want to respect my DA's time, and I want to respect my patient's time. And the way I do that, and what I found really helpful, is that my communication to the patient is always consultative. So I normally will ask them, what's most important to you? And I say, John, I'm really happy to fix this for you today, but depending upon how difficult it's going to be, we might not have time to do your checkup today as well. And I ask them, well, what do you want? What's most important to you? And usually it's the broken tooth. And I think patients are nearly always really understanding, particularly if I say, I'm not going to rush and try to do both things and do both things badly. I'm going to try to do each thing I do well. I think by doing this, I'm presetting their expectations and providing them with options and solutions while still trying to stay on time. And I think our patients appreciate how hard we try to accommodate them. And they appreciated that we're trying to stay on time so that we see them on time today, and we'll see our next patient on time, because they like it when we're punctual, and they respect my time too.
Yeah. So I guess while you need a plan, like all plans, they're meant to help, not hinder, right?
Exactly. I once worked in a really strict four-handed dentistry practice where it was frowned upon to vary what was booked in on the day sheet. You sort of had to really stick by what was there. And this really didn't sit well with me, nor with many of the patients. They, couldn't understand why you wouldn't really just bend, sort of go with the flow. The DA didn't want to have to reprocess instruments that had been opened, even though they were, sort of sterile, but they couldn't be reused, obviously. And it just, cascaded from there. But I guess in my mind, I saw that as just bad luck. It's just, you have to do what you have to do for your patient, right? And it simply wasn't reasonable to send a patient away in pain because you intended to do a filling and not address their immediate concern. So our plans, they're meant to help and they're not meant to hinder, but they need to be adaptable.
Yeah, but too many changes can destabilise us too, can't they?
Yeah, they can. We still need to ensure that wherever possible we maintain our focus. And my colleagues who constantly look at social media or who take too much time out to gossip or chat during the course of the workday can actually squander quite a few minutes here and there. And this all adds up over the course of the full day. So by all means, we need time to interact, but we also need to be able to maintain our focus when the situation requires it. And there's no point complaining about what you've just had to do on that last patient and all of that. Just, take it on the chin and move on. I see it actually requiring that we don't allow ourselves to get disturbed unless a matter is really urgent. So we don't want our receptionist phoning through while you're busy performing treatment to ask you a fairly trivial question that can wait till the end of the appointment. You want to avoid those sorts of distractions that hijack you from the task at hand. And there's heaps of research now emerging that just really highlights how unproductive we can become when we're being interrupted from a task that's consuming a lot of our attention. And particularly for us men who are required to multitask, we just can't do it. There's a limit to how many things we can do at once, particularly when we're performing complex or really detail-orientated activities. And I think also we need to really use our dental technology wisely. We need scanners and intraoral cameras set up and ready for use. Otherwise, they're unlikely to save us much time. So often we then won't use them as much as we should. Alternatively, if we do use them, then we want to be really efficient in using them and embed them in our routines so that we can still finish an appointment on time. They're meant to help, not hinder. So this also means that we need to focus carefully on the conversations we have with our patients when we show them the imaging that we produce from these devices, because while we want to inform and educate them, We also need to, at the same time, exercise some care that this doesn't then open up a bit of a can of worms and lead to a multitude of questions that cause us to run really over time.
I guess we can sometimes be our own worst enemy if we're not careful then.
Well, yes. Sometimes I even start up a conversation on something with a patient as part of the banter when I bring them in and they start launching into all the detail about that holiday that they've just been on. And then I've got to interrupt them and say, well, we better do some work, hadn't we? So a strategy that can be really helpful here is to discuss the big picture ideas with your patient. And then if that opens up that proverbial can of worms, either rebook them for a further consultation to go over all the detail, or arrange to email them or call them later to cover some of those details off at a separate, mutually convenient time.
That's great, Simon. So as we draw to a close, are there any other considerations you want to highlight in our discussion today?
Well, Annie, I think ultimately running on time or being punctual is a signal that you're trying to be respectful, organised and professional. It signals that you value the time of the other parties working with you and that you want to devote the time that's been allocated to their care. So even if that's not what you're thinking at the time, it can only serve you well and help you earn your respect from your patients and colleagues. None of our co-workers enjoy having to bail out the chronically late colleague, like my colleague that I mentioned earlier, or the person who consistently arrives late to work. It just isn't fair. We can all have a bad day, and I'm the first to accept that sometimes things just really fall over. But it really will irk if we abuse the grace of our colleagues by expecting them to fit our patients in and maybe run late themselves, while we feather our own nest by squeezing in that inlay prep to make ourselves a lot more money. It's just not the right thing to do. I also feel it's worth highlighting that having a jam-packed day is rarely as rewarding or enjoyable as having a few minutes here and there and having time to go into one's recovery zone. And I know you talk a lot about that, Annie. We need a break from being focused at least every hour, if we can. And squeezing too much in not only can make us run overtime if patients arrive late or something goes wrong during a procedure, but it also deprives us of the chance to freshen up mentally and physically. I really don't think we can perform at our best without those opportunities to briefly reset. So the pursuit of maximum productivity can sometimes backfire on us if we're not careful and actually lead to more error or, at the very least, actually a decline in the quality and quantity of our overall output, particularly as the day progresses.
So we need balance and good time management to help us achieve that, right?
Yeah. Good time management should really be a no-brainer. Our patients and our staff expect it. We've earned it.
Indeed. Well, the irony of the fact our time management podcast is probably one of the longest risk bites we've done is not lost on me.
I told you I talked too much.
But thank you so much, Simon, because that was incredibly helpful. And thank you all for listening. And we do hope that you found this podcast helpful to you. And we look forward to sharing more guidance with you in the future. If you like Dental Protection podcasts and you'd like to hear more, please subscribe and leave a review.